Good afternoon. My name is Carlos Campo. I am a pulmonary and critical care specialist at Tallahassee Memorial Healthcare. I am the medical director for respiratory medicine and critical care medicine. Today we're going to be talking a little bit about vaping. And before we move on at the bigger subject of today's conversation, which is teens and vaping, give a little bit of the background on vaping. I think that the initial intent of vaping was to give smokers a way of continuing to use nicotine without being exposed to the many other toxins in a cigarette, particularly all the known carcinogenics that are a byproduct of burning tobacco. What has happened though is that the vaping companies have marketed their products now to non-smokers. I don't think somebody that has been a pack-a-day smoker for 20 or 30 years is particularly interested in bubblegum flavored vaping device. I think that those products are more marketed towards children, teens, young adults. And that's, I think, why we're seeing this epidemic and it is an epidemic of teens vaping. Depending on the data, as many as 27% of high school students have vaped or are actively vaping. And there's an estimate that about 5,700 new teens start vaping every day in the United States. It has been in the news. There's been a number of adverse events to vaping, over 500 reported cases of vaping-related lung injury, and there's been 7 deaths so far. Most of the cases that have been reported are young adults, teens, not necessarily your 60-year-old who transitioned from cigarettes to a vaping product. And the reason for this is that there are many substances in the vaping device. Many of them we don't even know what they are because it's not regulated. Some of them are contraband products. But what we do know is that there's a number of different manifestations in the lung, from what we call acute lung injury to ARDS, to lipoid pneumonia, a condition called giant cell interstitial lung disease, which is seen mostly in heavy metals, but there are some metals that are used in the flavoring of the vaping products. So consequently, again, there's many manifestations of lung disease when vaping. As a parent, what you have to look for if your child is vaping are the symptoms of a rapid heart rate, rapid breathing, shortness of breath, chest pain. There's also reports of nausea, vomiting associated to vaping. I have children myself. They are teenagers, and we have had a frank conversation about vaping, the dangers of vaping, why it is as an addictive drug nicotine is, and again the consequences of vaping, of exposing the lungs to all of these substances, and what the consequences are. I think that the most important part is to trying to have a good line of communication with your children and have a frank and honest conversation about vaping. Know what be involved in their lives, and know what they're doing, and who their friends are, and what they've been up to. I think that for any questions, there's a number of resources available, particularly through the American Lung Association at lung.org. You can also reach tmh.org for any further questions. Thank you very much.